I'm Dr. Sherwood Baxt. I am a board-certified plastic surgeon practicing in Paramus, New Jersey. I have a patient with me who had surgery a couple of months ago.
Early February?
Okay, a couple of months ago. And this is one of our signature operations now, which is gynecomastia, or male breast reduction. And there's a specific variation of the operation that I do, which is the scarless approach. Now, technically there is a scar, there's a small scar, but what we're avoiding is the big scar around the areola. How'd you come to us originally? Why come to me out of a bazillion people around that do this operation?
Well, actually, the scarless approach is what appealed to me, and you can find it pretty easy when you research it on the internet. You pop up pretty quickly.
Okay.
At least from my research, you did. The other approach definitely drove me away. I was very uneasy about the big scar,
Right.
the areola, and so I looked into the scarless approach, and I've read reviews, and Baxt Cosmetical was just always popping up, and then I looked into it and got the consultation.
Okay, so how do I do it without putting the scar around there where just about everybody else does? Do you remember? Let's see. Maybe you can do this whole video for us. Go ahead.
You use the liposuction technique that other surgeons use for
Right.
fat,
Mm-hmm.
and then you're also, with another tool, you're able to break up the glandular tissue.
Yeah, the way the operation's done, good, correct, it's a micro-excisional tool we use. The way the operation's done is we all do it the same way up to a point, which is we all do a little bit of liposuction in there. And then almost everybody is now going to make a scar around the areola, and when there's gland tissue, the whole rock-hard gland tissue, and go in there and cut out the gland with a scalpel, and you take it out piece by piece. What we do is it's a very expensive piece of machinery called a micro-excisional tool, and we use it to grind up and liquefy the gland tissue, and we can suction it out through that same small incision. So there's no stitches, no scar around the areola. Recuperation is usually a lot faster. Yours wasn't. If I remember, you had a fair amount of swelling on one side. It took us a little bit longer, but that's within the normal variation of from patient to patient. Do you remember what I told you about this coming back again? About it, could it recur or?
Well, it is permanently gone, so it's just the swelling needs to go down over the next couple months, and that is that. And
Right.
There's no recurrence of the glandular tissue.
Mm-hmm.
So.
How do you feel about? If I remember correctly, even through clothes, you could see your situation.
It was noticeable through an undershirt, through a t-shirt. Basically, if I didn't have heavy clothing on, heavy baggier clothing, then it was noticeable.
Mm-hmm. And how is it now?
And now it's very unnoticeable through just a white t-shirt.
Okay, but I told you, because I just examined you a little while ago,
Sure.
you actually have a ways to go yet. This will get considerably better yet.
Sure.
So it's good now, but it should get quite a bit better. At any rate, one of the commoner operations that we do, it's called the scarless breast reduction, or male scarless breast reduction. Thanks for coming in, appreciate it, and happy to sit and talk to anyone about this operation.